Morning. We're going to go ahead and get started. I am State Senator Nick Miller, representing parts of Lehigh and Northampton counties. I also serve as the policy chair. And today we're talking about small necessities leave. I've got Senator Haywood as our co-host, and a beautiful warm day here in Pennsylvania. I want to thank our host, Penn State Abington, for hosting us. Thank you, Chancellor. Great to be back on a Penn State campus as a Penn State alumni. With that, I'm going to, for opening remarks, pass it right over to Senator Haywood to get us started. Thank you.
So thank you so much, everyone, for being with us this morning. I represent parts of Philadelphia and Montgomery County, and this is certainly part of my district. I'd first certainly like to thank everybody from Penn State Abington. Thank you, Chancellor Gary, and everyone from the university. I saw so many friends that I haven't seen in a long time, including Professor Golden, so very glad to be here. I'd like to thank Senator Miller's staff for making sure all the prep is done, and as well as those who are in the main caucus in Harrisburg. Good to see my good friend, Representative Sanchez. Thank you so much for being here as well. And for all the testifiers, some I've met already, some I may not have met already. So this is legislation that looks at a key question, which is, what is work-life balance? And we've talked, you probably heard many conversations about what it should be, so that individuals have some time for home, they have some time, obviously, for work. But for millions of families, this work-life balance is critical. It allows them to either care for someone who is sick or who has a school appointment, or lose work. Employees are not just workers. They are also family members. And so we're talking about a dad who may need to take time off because the child has a IEP meeting, special meeting for a child. It could be because of a mother needs to have a visit with a physician who is taking care of her mother. These are two of many examples of where 2 hours, 4 hours, 6 hours of time off with pay can make a difference. We know that there are roughly 2 million people in Pennsylvania, adults, who provide care for loved ones. And a small emergency is something that can prevent a catastrophe by allowing a person to have the time to care for someone who needs care. Now, this Small Necessities Leave Act comes from an example in the state of Massachusetts, and is intended to be a small bridge for individual employees to take care of small necessities. It grants employees up to 24 hours of protected leave every 12 months. That could be 3 8-hour sessions. It could be 6 4-hour appointments, all of which can be critical for care or for school. So I'm very glad to have the panelists here today so we can further explore what the small necessities approach that we have proposed can mean for Pennsylvania. I'm glad to turn over now to Senator Miller for our first set of panelists as we begin that exploration today.
Thank you, Senator Haywood. For our first panel, Dr. Golden will kick us off, insight into this legislation, Professor of Economics and Labor Human Resources here at Penn State University, Abington. Dr. Golden.
Thank you. It's such a pleasure to be here, and it's such a pleasure to host you at this beautiful location, even on a frigid day. Great to see Senator Haywood again, of course. I'm here as a labor economist, and what we do is practice the economics of long-term versus short-term, the cost of doing something versus the cost of not doing something. So it's a pleasure to be here providing support for this bill. So I'll give away the punchline. I'm going to support it. And And my research has been about the labor market in general, about work, work hours, work schedules, flexibility, and currently working on issues about job quality. So this speaks right to that. I've taught several courses here that this is relevant to as well. So for today's quick talk, I'll give you the context of today's labor market, why this is important and timely, how the Small Necessities Leave Act fits in with some of the research about the effects of workplace flexibility, and some of the patterns that we do see, at least at the national level, of disparities in other types of leave. So what is the Small Necessities Leave Act? It covers family and caregiving needs of the employed that are not included in the Family Medical Leave Act. It's much more daily, occasional. It's filling a gap that exists right now in the parental leave laws, which 14 states now in the U.S. have paid leave, and that everybody gets unpaid leave in the U.S. if they worked in their job for at least a year, and they get 6 to 12 weeks. But this would provide a bank of time up to 24 hours, job protected, meaning there's no retaliation allowed by employers if the employee uses this. In this case, it's unpaid, and it's but particularly short duration and just intermittent, not a large chunk of hours, typically, as the senator said, 2 to 4 hours in a given day. So what's our context? We look at labor market trends, and the labor force attachment has not been going up over time, and mothers' labor force participation is no longer rising, unlike a previous generation, and parents still pay what we call a pay penalty for their earnings are reduced or penalized if they have children responsibilities. So we know there's some work-family conflict going on. It's particularly intensified for those that are in dual earner or single-headed households. And there's this unmet need to reconcile both the time conflicts that workers tend to have if they have children or elder care responsibilities, and also the role conflict, switching from their parental roles to their roles as an employee or worker or earner. And these tend to be exacerbated by the persistence of non-standard work schedules for many such workers. What I'm finding in research is there's a high value attached to flexibility and the kind of terms that this bill addresses. So one of the significant explainers of how high or low workers rate their own job quality, it's quite positive for having control over their time over the course of a day, and quite negative if it's all in the employer's control. And about 4 in 10 workers consistently say across various surveys, at least in the US, that their timing of their schedule is determined completely by their employer. And only single-digit percentage says they control their own timing. So there's a lot in between where there's a mix between employees having some input and employers having some ability to say yes or no. So that's part of the context. 1 in 7 workers apparently in the US do have some elder care responsibilities, and I object to the elder care definition being taking care of relatives that are 65 or older. I don't think that's elderly. And I think some of us would agree with that. But in any case, we have responsibilities for parents or grandparents or family relatives, and that is sometimes flies under the radar, and in terms of a daily stressor and having to spend some face time with relatives. The Small Necessities Leave Act is a relatively modest, very soft touch that has both what we call a public goods case and a business case, and I'll make both. So on balance, it's probably going to be good if we adopt this in Pennsylvania and take some leadership, because only Massachusetts has adopted this so far. Some of my own research that speaks to this is that we ask in surveys, in national surveys and some of the surveys that I've done myself, that taking time off for a few hours during the workday for family or personal matters is very salient in terms of the effects this has. About 42%, so it's a half glass full, say it's not hard at all to take off. So a lot of workers already get this type of flexibility. But the research I did with Kim, Henley, Golden, and Lambert in the Journal of Marriage and Family finds that it's significantly associated with lower work to family conflict, less stress that they experience from work, greater family satisfaction, more time with children, and also some positive outcomes for the organization. such as satisfaction with their job, lower intention for turnover, and organizational commitment. Indeed, this is bolstered by researchers at the National Institutes for Occupational Safety and Health, which are back to being full-time employed as of this week, by the way. They take time off on a daily basis, reduces the likelihood of job stress by 56% and more than doubles the likelihood of having great job satisfaction. In my written testimony, I'll present some of the national data, which shows that a lot of workers do have access to various types of leaves, personal, holidays, sick, and vacation, but it's disproportionately strong and higher among those that have high earnings. So this bill would address in a more the disparities in that and give access to the daily type of personal leaves that Senator Haywood spoke to for those, particularly if they're part-time, but those in relatively low-wage jobs. A typical survey, not to cite one in particular, called the Motherhood on Mute Report by Live Career, very typically says that over half of women have switched jobs due to childcare costs, and about a third have left the workforce entirely, and that's what we're trying to prevent here. 96%, almost everybody responded to the survey, said they face pushback for consistently leaving work at a set time, like at the end of a workday for a school pickup. Oftentimes, even those that have paid time off suggest that this time off exists on paper, but in practice, it's much more difficult to implement. 3 in 10 say they fear layoffs if they take advantage of this, so they're hesitant to take time off, and about a third don't use all their existing paid time off. And about 1 in 11 say their workplace even actively discourages using this paid time off. The Small Necessities Leave Act, there's very little data available about this. Only Massachusetts has adopted it. I'll make a plug for funding such research from the Pennsylvania State Houses because we want to do a before and after. If somebody has this right now, if they don't. If they have it informal and now would get it more formally, to what extent does it support the kind of results we see in the states like California and in New Jersey where they have paid family leave? Does it indeed make it easier for caregivers to balance both their work with their non-work responsibilities? Having said all that, when we're in our role as employer or administrator of an organization, there is a burden to this, right? So organizations might have to start tracking this, and HR might have to start giving some reports and accounting, tracking people's use of this. And some firms, particularly the smaller ones, are going to be at risk of having some coverage issues. They already lean staff very much, and this would make it even leaner. There's also, with any regulation, right, protection, support, there's a perceived risk of misuse of that. So it would have to be monitored and managed. But this bill does not require wage replacement. So we can't really take seriously any case that says this is going to be very costly to employers other than the administrative burden. There's no direct pay involved. It's either the salary that they already earn or that this would be unpaid, as far as I've read the bill. So what are the potential long-term benefits for employers, if there are short-term costs? There's some evidence that, again, it improves workers' job satisfaction. So as a result of that, they're more likely to retain senior experienced staff and not have to face turnover costs, which are quite substantial. It might enhance their recruiting competitiveness, which includes the state of Pennsylvania attracting employers and employees to the state if they know they're going to have this type of 24 hours of leave guaranteed over the course of a year. Like other leaves, maybe it prevents some of the disruption that leads to those turnover costs. So even though they might have to cope with a few hours a day periodically, maybe on short notice, the long-term benefit is to maintain a workforce continuity instead of having to replace and search and train new workers. If people are leaving because of these day-to-day responsibilities with caregiving. Some of the experience with the case of paid sick leave, which is in Philly and also is being proposed in the state Senate, that the follow-up showed that the employers rarely face any significant costs. One key study of this at the national level asked about how easy it would be, and the employers said very easy or somewhat easy, and about 9 in 10 employers reported no or only very slight increases in their administrative costs linked to this responsibility for tracking. If it's okay to bring in a minute, some of what our sister countries across the ocean do, and what's being proposed in Washington as well. In the EU, there's a minimum standard of providing for personal care or support. Each person is entitled to at least 5 working days. The SNLA would only be 3 days, so it's more modest than that. And so there's very little objection to that. They also have rights to request and rights to refuse work, or at least overtime work, and the rights to request when the child is at least up to age 8. Care for children, that's a little bit more formal in the form of reducing their standard work week, have more flexibility over the timing of their workday in the morning and afternoon end times, and as well as some flexible work location. And they do have, as the Senator suggested, some leave that's guaranteed for urgent family reasons. So in a broader context, this bill is a nice fit, or at least blends with other ways in which we're trying to protect workers from the unexpected and sometimes expected conflicts that are going to arise in their time and roles day to day if they have parental or elder care responsibilities. They can have a right to request. The Fair Workweek legislation, which is now law in Philly, provides some predictability, mostly advance notice, some expectation of what their work week is going to be. So it fits hand in hand with all this. The Pennsylvania Senate Bill 901 and House Bill 200, the Family Care Act, would establish a dedicated fund and benefits for workers to leave for family and medical reasons that these 14 other states already have. And there's sick leave legislation that has a minimum right to a certain number of days, or 40 hours, I believe, of paid sick time in a given year as well. I could also say that there's potential in the state of Pennsylvania that has a proposal, at least, for the 4-day work week, and that would, of course, give families a lot of opportunity to sort out their family conflict time. So, to conclude, our takeaways is that this fits or at least fills a critical gap left by the FMLA. It's very modest in terms of the cost and might deliver very meaningful daily accumulated well-being gains to workers that have ability or inability, currently insufficient ability to balance their work with non-work needs, and it provides some of the, or fills some of the gaps that would be existing currently in the disparities into who has access to these kind of paid leaves now, informal leaves now provided by the employer. Thank you very much.
Well, thank you, Dr. Gold. I want to Representative, thank you for joining us. Any legislation has to get through both the House and the Senate, so thank you for joining us. So, I want to acknowledge a couple of my colleagues as well online. Senator Jay Costa, our leader, joined us. Senator Lindsey Williams and representatives from Senator Capoletti and Fontana on Zoom as well, joining and listening. So open up to any questions. Senator Haywood, kick us off. Go ahead.
Yeah, thanks so much. I do want to say that it is our intention that this be paid leave. So with that clarifications we need to make, that is the intention of the legislation. So we do want to make that clear. Now, you mentioned the set of employees that would be most likely to benefit as those who are not in the higher paying positions. What are some of those jobs that that folks are in that would be more likely to benefit from this legislation?
It's a really good question and a detail that we probably wouldn't be able to get, excuse me, at the Pennsylvania level. But typically, it's relatively lower paying jobs that go hand in hand with that. So it can be retail, it can be hospitality, restaurants. Particularly part-timers are much more vulnerable to that. So that's something to take into consideration in the legislation, is whether or not it's going to be prorated based on part-time status or number of work hours per year. Not sure what Massachusetts did, if everybody that's part-time or full-time, as long as they're on payroll, will get that. The people who are vulnerable, people that are churning between jobs as well. Of course, independent contractors and temps that don't get any of these type of protections by law whatsoever in labor and employment law. So it's jobs that are probably in certain sector. It's probably more blue collar than white collar. It's probably more part-time and non-employee than employee. But that's a really good question. But it would be the people that are already more vulnerable to schedule irregularity, unpredictability, instability in their work. They can get called off. They can get called in on short notice. So this gives some of that control, modest as it is, to the employee to say, with some advance notice to the employer, I'm sure that's going to be part of the bill, that I have something that's unexpected or something expected in the near future. You know, that the school ends at a certain day early, or maybe there happens to be a holiday in a certain day of the year, like January 20th, and the parents are right now scrambling who's going to do the coverage at home and who's going to be able to go to work or have to call in.
No, that's helpful. You mentioned role conflict. And for most employees, you're working, you've got a bunch of different roles. You got what you're doing at work. You have what you got to do after work and what you got to do on the weekend. I mean, there's a lot of aspects of being a worker, doing work. So for this work, the conflict that you described, does this help reduce the conflict for employees?
Really good question. I think on the employee side, we normally think of flexible working as you can come in early or late and slide the workday if you're there for some core hours. But what we found was that workers really value that ability when they suddenly face an urgent call, unexpected call or email that says your child is sick, someone's got to pick them up. The doctor wants to know if you can come in earlier or later, or the wait time is lengthened and we don't want to leave them on their own. So I think we think of the time conflict mainly, and that is a main one, but it's often that role conflict, that your head is in your work role, in a meeting, serving customers, serving food, and what are you going to do if suddenly, we know we have to try to separate this now, right? But what do you do if indeed that's a real severe instance where you're willing to take off some of this time that's in your time bank to address this and go off site, or at least address it, with a call. So we face these all at the same time, and some jobs provide the flexibility to do that, either at the ends of the beginnings of the workday, or to attend to these things while you're doing maybe a white-collar job, but sometimes some people don't have that kind of flexibility, and this would provide that for them. And it would be highly valued if it were available, and it was not penalized.
Yeah, your framework of this is being part of the leave bank. I think that's extremely helpful. My last question is on unintended consequences. And so that's all part of cost benefit. And what would you see as some of the possible unintended consequences of this legislation?
I mean, to be realistic, there might be some employers that say, I don't want to hire parents, but I think we're kind of past that. So that is an expectation. But if you do this statewide, I think that means that the ones who don't hire the parents still have to provide this, so they don't get a competitive cost advantage by offering more harsh working conditions. So I suppose it does create a norm that, and that does create the possibility for people to abuse and maybe go all the way up to the paid time off bank that they would have. But we often see in research, and I get calls on this a lot in the media, that a lot of workers that have a lot of paid time off that they can roll their holiday pay and vacation together, they don't use all of it. So it might be an unintended consequence that an employer that's lean staffing says, I really need you to stay, and they say, I really got to go, and they didn't provide enough buffer staff for that. So that could be an unintended consequence, but there is a relationship that employees have with their employer, and sometimes it's a good one and say, okay, give me just a few minutes, I'll handle this now, I don't need to go off-site for the rest of the day or for half a day or something like that. And they can have a mutual reciprocal relationship where, yeah, if you really need it, I'll make sure that there's enough staff and that there's coverage available on short notice.
Thanks so much. And from a turnover perspective, I would think this would possibly reduce turnover because folks would be more likely to stay with an employer that had some more recognition for the conflict that you described.
Yeah, I mean,
Thanks so much.
there's good reasons why employers provide these kind of benefits already, right? For retention, they want to value their human capital, and they understand the costs of constant turnover. So this is mostly a minimum protection for people that don't have access to that right now. And so it's on top of that, and I think, yeah, we have to have the type of employer that's willing to think, more humanely, but also more long-term, that this is also to their benefit. If indeed, like that informal survey suggested, that a lot of people are not joining the labor force or left the labor force just because they have these constant small necessities for elder care and for child care.
Yeah, I think it makes a lot of sense. And when you're trying to convince the business, just industry, how do you quantify those benefits? And knowing that we have an aging demographic here in Pennsylvania, our caucus has prioritized workers' protections on a number of different hearings just like this. And you mentioned funding for studies, but how do you quantify the value of those workers' protections long-term for those businesses as we try to make that argument, that case?
Well, that's kind of my lifelong work, and the communities that I'm involved with are trying to gather that evidence and present the evidence, at least to the leadership, that this is in your long-term best interest. You try to show that if you can measure this, the productivity does not suffer, right. At least short-term, and that long-term you get these savings that accumulate by not having to search, hire, train more and more workers that have unfortunately left the workforce for reasons maybe they expressed to you, maybe that they didn't, that they had these necessities and that were building up, and they just left the job for reasons that had nothing to do with them liking their job, being satisfied with their job, and particularly being good at their job. Right. So it's a wake-up call to employers sometimes that they weren't providing this, and this provides this minimum floor and sort of an awareness, even if they don't use it, that this is available if and when they need to take advantage of it. And the employer gets the benefits of being a good employer that can retain their workforce, and they can meet some of their needs that they might not have already met, and or been driven to be cost saving on a daily or hourly basis, and recognize that there's some long-term payback from this.
Yeah, yeah, and I appreciate that insight. I mean, we definitely see challenges with elder care and child care in keeping folks in the workforce or bringing them back to the workforce post-COVID. So I will open up to any other questions from my colleagues. Representative, go ahead, yes.
While we have Dr. Golden, and I want to thank Senators Miller and Senator Haywood for lifting this up, such an important topic, one that I wasn't completely familiar with, but fascinating, and certainly sounds very compelling and in need. I was reading recently, and this kind of dovetails with the role conflict and also the why companies would value this. I was reading about, I think it was Latin American countries, possibly South America, where there were these informal networks emerging of, for lack of a better word, kind of a cooperativeness in a neighborhood where people had maybe worked for some of the same companies, and people would get together to help each other with kind of the small necessities, doctor's visits, laundry, taking care of the kids after school in the hours that people weren't working. Right. And I think it was catching on so well that, the informal networks started to get formalized by the employer, recognizing that this was making better workers, happier workers, more fresh, and didn't have to take as much time away to do these sort of things. So wondering if that's come up. You mentioned a couple of overseas, countries that were investigating this type of thing. Have you seen any of that in your research, or is that something you might look toward as an example in this?
Very good question. There are examples of that, but so yes, it springs up organically. So if the employer can get the credit for that, why not provide that? But a lot of workers don't have those informal networks or availability for that, and don't have money for high quality, expensive daycare to maybe take care of that. So this informal arrangement does fill the gap, and I think it created a norm where the employer just took it over, or at least contributed to that. Maybe it'll now be the other way around. That if it becomes this norm that, hey, everybody gets 24 hours of leave, and so, hey, let's talk to the other parents that I've met at the playground or at the child care center for after school. How do we arrange if one of us can't be available either before or after the workday, or gets called in on the weekend, or has a project that has a deadline? So I think there's a two-way street there, that the informal networks are reflecting that there's a gap coming from the employment world, but it's also something that could start to create a consciousness of that and create more formal structures for neighborhoods or communities or even online communities to try to arrange this. Just as is what's springing up with babysitting. I mean, we know that certain neighborhoods have that already, right? When you go through that time of life. And sometimes grandparents are not always available because they're still working too.
Any other questions from my colleagues? Okay, seeing none, thank you, Dr. Golden. Appreciate your insight here. That concludes our first panel. We'll move right into our second panel, supporting families. We have representatives from the Fund for Women and Girls and Children First, Dan and Blake. Join us up front here.
Thanks.
Blake, you want to kick us off? Dan, we'll get you a name tag then. Oh, I have it. Oh, you have it, okay.
Can you hear me?
Yes.
We're good?
Yep.
Okay, great.
Thank
Thank you so much. My name is Blake Emanuel. I am the Director of Advocacy and Policy at the Fund for Women and Girls. We're a nonprofit located in Chester County, Westchester, but we serve all of the county. We do a combination of grant making and advocacy work. And so while we do grants in Chester County, while we're looking at gender equity, which is our mission, we do look at state level issues because we know that policy has a significant impact on outcomes. While I'm here professionally, that's how I was invited, I'm also representing families who have children with disabilities. I'm a mother of two. My older child has multiple disabilities, has had his entire education received special education services. So in addition to speaking to why this is a women's issue, I'm also going to be speaking to why this is a disability issue. I sent ahead written testimony, and for anybody who checked it out, don't worry, I'm not going to read it verbatim. Representative Sanchez, happy to pass it along your way as well. It was quite lengthy with quite a few links citing resources. With the fund, we are focused on gender equity. We look at it through an intersectional lens. So while our first lens is women, we are also looking at other identities that impact outcomes. So looking at race, ethnicity, educational attainment, employment status, things that will build towards that picture of why we are seeing the outcomes that we are seeing. So from a women's issue perspective, we know that women fulfill the majority of caretaking roles. It's around 75%, hard to get an exact number, but we know that women are the ones who are taking time out of their jobs, taking time out of their careers to care for children, to care for aging parents, to care for children with disabilities or other loved ones who have disabilities. A new census data revealed that in the first 2 weeks of 2023, 6.8 million adults took time off for caregiving. In addition to this, we know that to level the playing field for women who, and I will get into this, are still not making what men make dollar to dollar, that we need to provide and ensure that there are policies and practices in place that allow for them to manage and navigate those caregiving and employment needs. You know, we heard earlier about work-life balance, talked a lot about that. But the reality is that it's life balance. These women are taking care of not just bringing home enough money, not just their children, not just their elderly family, they're also to be taking care of themselves as well. We need to provide in such a way that that's feasible. It's a health issue as well. Women spend 25% more time in poor health. Should clarify, any of the stats that I'm giving you are in that write-up, so don't worry, I bring receipts. Data supplied by the U.S. Department of Labor found that women need to take more leave for family or medical reasons, 24% versus men who need to take 17%, and that they still have even more unmet needs. So women report a 9% unmet need based on the time they are taking off versus a male's 6%. It's an economic issue. Dr. Golden just went into a lot of the economics, but I think we lose a little bit in sight of caretaking versus economics. You can prioritize caretaking and prioritize families and well-being and still see benefit on the economic side. There was discussion about concerns regarding what businesses might maybe object to. There have been lots of studies. While Massachusetts is the only short-term leave, there's an abundance of studies on long-term paid family leave. Some in the U.S., lots in across the ocean or down south. We are the only developed nation with no paid family leave national program. So there's plenty of data that supports it. It not only supports the benefit to the employee and their family and their loved ones, but it also supports the benefit to the business and organization. There is an increase in productivity, which results in higher revenues. States where this has already been enacted in the long term have reported that businesses were not notably adversely affected. And that includes small businesses. We often hear a lot from small business or micro businesses that these types of policies would be debilitating for them. What we're seeing from the research and studies, that's just not the case. So I mentioned I would get into wages and the gender wage gap. It still exists, and not only does it still exist, but the last 2 years, it's gotten worse. And when we look even deeper than just the gender wage gap, which currently sits at 80.9 cents to the dollar, when we look even deeper, so we look at race and ethnicity, it is worse. Black women make 68 cents to the dollar of white men, and Latina women make 56 cents to the dollar. They are barely making more than half, and these are for full-time employed individuals. Lower wages, loss of employment is less economic stimulation. So we can talk about this both from the economic and the, quite frankly, human and moral side of this, and it all fits together. I've been taking notes as folks are speaking and asking questions. So I think one of the things that I would like to add when we talk about who benefits from this is really emphasizing hourly employees, specifically hourly employees who do not have benefits, which is most of them. These roles are predominantly held by women and people of color. When there are less benefits, they are that much closer to the fiscal cliff. They lose a job, they lose time, and now, and I'll get into this later, we're looking at their dependence on crisis systems, on social systems that they didn't need to have support from before, so long as they were employed. So what we need to ensure is that they remain employed. Yep, so I made all those points. Okay, great. So focus on women for the purpose of this testimony is because of what I do for a living. But let's be clear, this benefits everyone. This benefits men just as much as women. So I did just want to call that out while I'm here as a representative from a gender equity organization. We all would benefit. From a disability perspective, we're looking at first medical care. The number of people over the age of 64, I know some folks don't like talking about over 65ers, but we're going to, in Pennsylvania is over 2.5 million individuals. So when we think about aging parents, and I'm of the sandwich generation, I have children that I'm caring for, and I have aging parents. These folks are exponentially struggling to ensure the needs that their families have, that their loved ones have. The more I am able to support my aging parents, the less dependency those parents have on our systems. So again, I'm going to circle it back to that economic standpoint, because really there are arguments for this from every angle. More than 1 in 4 adults has a disability. So when we're talking about need for care, we are talking about 1/4 of the adults in this state. And I want to point out, while it might sound morbid, the reality is that disability category is something that at any moment, any of us may fall into. It is the one identity that, unfortunately, a simple car accident could change, that a medical issue that was unexpected could change. So while we might talk about it in the abstract, right now I personally do not need this bill. I would not benefit from it. I have paid TO from my employer. The reality is that at any moment my circumstances could change. Any one of ours can. So we think that's another key piece to considering the disability side. Educational needs. I will spare everybody because I could talk about special education for an entire additional session, but the reality is that special education will make or break a child's future, and I can tell you that firsthand from my personal experience. In addition to being the parent of a child with special needs, for 10 years I served as a special education advocate. So I work with families and help them navigate the system. And for the last 15 years, I have been an educational surrogate. So I have supported, through volunteer work, students who are wards of the state and are in residential placements, be it a residential treatment facility or an adjudication placement, and supported them with their educational needs. So I could tell you, without a shadow of a doubt, the access to good special education is critical for these students, and that access is incumbent upon somebody who's engaged in it. Students aren't going to engage themselves. They need a parent, a guardian, someone who is going to ensure that they are getting that education. I know that the reason my older child is successful today, having just graduated from college, is because of the education he received. Had he not received that education, I am certain he would be on social services. He would be in the judicial system. There are a lot of scary, scary realities for parents and guardians of children with disabilities, and this needs to be taken into account. And the reason this needs to be taken into account is because I attended an average of 6 IEP meetings a year for my child. Good years, we got it down to 2 or 3. Challenging years, I think my highest was 10 or 11. And we had a wonderful team, phenomenal school team. I had home supports. I had access to everything possible. But to be engaged meaningfully in my child's education, I had to be there. Being there took time. At that time, I was not as privileged as I am to have the job that I have, and I was not paid. I was privileged that it did not push my family over the financial cliff. That is not the reality for so many. So this is also an economic issue when it comes to disabilities. We can take care of folks as early as possible and meet their needs to the best of our ability, or we can wait till we are in crisis, at which point those individuals are now utilizing systems funding. Their families are in crisis. There are so many components to this, again, trying not to go on, but this is a critical issue for disabilities. And I just want to reiterate, it could be any one of us at any moment. In addition to these 2 lenses, I did look at the legislation. So I did want to just briefly mention that on page 3, subsection C, under limitations, number 4, the way that I read it, I think clarification would be phenomenal, is that it is paid. An employer shall provide payment for leave taken under this section no later than the payday for the next regular payroll period after the leave was used. So it's certainly worth revisiting whether the language reflects the intentions. So far as I read it, not a lawyer, not playing one on this morning, but read like paid to me. So under who qualifies, I would ask that there be consideration given to adding a subcategory specifically for domestic violence survivors. These are individuals who are dealing with so much. As previously mentioned, the Family Care Act is wonderful legislation, Senate Bill 906, House Bill 200. And included in it is, under the who qualifies category, there is domestic violence survivors. And so a brief story as to why we feel so strongly about that at the fund. I have a volunteer who is a domestic violence survivor, and part of her story includes the challenge of navigating work and getting a PFA, a protection from abuse order. She had to choose between going to court for the PFA or going to work because she had no PTO and ensuring she could keep a roof over her and her 4-year-old daughter's head. She had to choose the roof over her protection. This is not a choice anybody should ever be forced into. So I would respectfully ask that consideration be given to adding domestic violence survivors into individuals who qualify. Additionally, Family Care Act utilizes the verbiage reasonable expectation of care. I think that that is worth consideration as well, as there's somewhat narrow definitions within the current legislation for who would qualify. So I would ask for that. Under what qualifies, this is personal, but I mentioned educational surrogacy. I know that it is very hard because I get the calls begging me, we can't find anybody. Can you take on just one more student? So that might be something. When we talk about special education, the bill mentions early intervention and school age. What I would request is consideration for that preschool age, so birth to 3 years. The early intervention phase is critical. My own child started receiving services at 2. So looking at any educational service from birth to 21 would, I believe, be appropriate. Additionally, Head Start is mentioned. It does not cover intermediate unit services. So there's a lot of students receiving special ed services who are not covered under the bill the way it is written. Routine medical or dental appointments, what about non-routine? So my other child, who thankfully is fine, did have spinal abnormalities. So anywhere between 4 and once a year, we were down at DuPont getting his spine checked. Not routine, but still requiring leave. So again, this is some of the verbiage. This is included in that written testimony that I submitted. There's a lot more, but I will conclude one of the 2 things. I would again respectfully request consideration for thinking about this as a package deal. This is a piece to a puzzle when it comes to addressing the needs of women and individuals with disabilities. So thinking about other bills that exist that are very clearly in line, the Family Care Act being one. For short-term leave, this is phenomenal, right? I've listed out so many of the ways in which this is critical. Longer-term leave is equally critical. So thinking about, again, my own story, I have PTO in my current position, but I work for an organization that is micro. There's 4.25 of us at the fund. So we cannot afford paid family leave. So 2.5 years ago, when I needed surgery for a brain tumor, I used up all my PTO between the pre-op appointments, and I had a little bit left over. So 1 week after surgery, I had paid time off. For anyone who's not familiar, minimum amount of time for recovery from a brain tumor surgery is 3 months. I was back at work in 1. So thinking about this in terms of a larger picture, I believe would be the best way to move forward. Thinking about who are allies, who will do this work, who will push this forward, because we need a multitude of issues addressed in Pennsylvania. As mentioned, our aging workforce. One final story with that workforce relating to the economy side of this. Another one of my volunteers, she's originally from New York. She moved to Chester Springs, which is in Chester County, and her boss at her employer, they have offices where she was in New York, Philadelphia, and New Jersey. Her boss, knowing that she was planning to start a family, suggested that she actually transfer to the New Jersey office because New Jersey offers paid family leave. We are surrounded by states that, while they don't have the short-term leave like Massachusetts, they do have family leave. So we are losing employees, taxpayers, business to other states that are affording these benefits. So finally, policies. such as the Small Necessities Leave Act, have been shown in other states to positively impact both employers and employees. They begin to address historical and institutional sexism, racism, ableism, as well as gender and race-based employment segregation. Outlined, there's substantial research and data that supports the need for these policies. Pennsylvania is facing an aging workforce. We're surrounded by states, Delaware, New York, Maryland, and New Jersey, that do offer paid leave options for their employees. Passing the Small Necessities Leave Act would be an important step in the right direction for all Pennsylvanians. Thank you.
And thank you. We'll turn over to Dan real quick, and then we'll open up to questions for the two of you. Dan?
On behalf of Children First, thank you for the opportunity to present testimony regarding the Small Necessities Leave Act. As many of you know, because we work with you often, Children First is an advocacy organization that focuses on issues that impact families and kids, in particular to improve public health and education, and to boost economic opportunities for their families. As Blake did, allow me to update this esteemed committee on how Pennsylvania stacks up against other states with respect to adopting policies that help families work their way out of poverty and then also prevent families from falling into poverty. There are plenty of active proposals working their way through this legislature now, albeit very slowly, that are already in place in other states, as Blake mentioned, that have proven to work. So New Jersey, New York, Maryland, and Delaware, as Blake mentioned, each have prioritized paid family leave policies and other family benefits that we know have attracted families to raise their children in those states, because the rhetoric about supporting families is backed up by policies that do so. I say this often, but I live in Bristol and Bucks County and went to Abington for a year. I can see New Jersey from my house if I actually went up on my roof. If I lived literally across the Delaware River from where I can see, I would have access to these benefits that we already speak about today. This legislature spends considerable time debating measures aimed at growing Pennsylvania's economy, from energy to AI policies to new laws that streamline permitting and kind of reduce burdensome regulations. But as you all know, it's simply not possible to grow the state's economy without simultaneously prioritizing the Commonwealth's workforce, especially common sense policies that make it possible for families and working parents in particular to stay in the workforce and care for their children at the same time. As parents, I'm a father of two. Our number one job is to care for our kids. Imagine having to choose between protecting your job and getting your kid the medical attention they need. There are many parents throughout Pennsylvania today who simply cannot leave work to take their sick kid to the doctor. This is the United States of America. That is a ridiculous concept. As someone who has a 4-year-old at home right now, sick, it's very present. Not only may they face pressure at work, but even if they have an understanding employer, many of those parents cannot miss a day of income or even 2 hours of income to go to the medical appointment, and God forbid, a day or two following, and really God forbid, if they have a serious illness, either their kid or an aging parent. The Small Necessities Leave Act brings attention to the simple fact that due to the lack of publicly required job protections in Pennsylvania, thousands of parents are put in the untenable position of losing their job or missing appointments for their children. This measure shines light on the fact that we live in a world in which there are either single-family households or two working parents in most households that can't afford to keep up with cost and lose income on a daily basis for these issues. And these parents are very clear about what is reasonable and what's needed for them to be good parents and good workers. Parents were found in a recent Bipartisan Policy Center poll, which was conducted by Signal, a conservative polling group, that work-life balance and financial strain are the top two challenges facing families. Also allow me to point out that families need more than what this bill will provide, and I know each of you know this. They need the workforce protections that guarantee all Pennsylvania workers have ample paid family and medical leave. In fact, 81% of voters in Pennsylvania, including 67% of GOP voters, want Pennsylvania lawmakers to make that a reality. I want to commend everyone on this committee for being a co-sponsor of the Family Care Act, which was mentioned. it has the strongest support of any legislation in both the House and Senate. It's got 88 co-sponsors in the House, Representative Sanchez, and for HB 200, and 31 co-sponsors, which includes the entire Senate Democratic Caucus and 8 of your Senate Republican colleagues for SB 906. That is an incredible amount of support for paid family and medical leave in Pennsylvania. When adopted, the Family Care Act will establish a paid family and medical leave program for the 4 million workers who currently don't have these protections through the employer. Again, I go on my roof, I look in New Jersey, they got it there. According to a recent KPMG study, another very liberal group, working parents said paid leave policies are the most critical support employers can provide them. Yet only 27% of employers with more than 500 employees, yet only 27% of employers offer paid family leave benefits to their workers. Right here in Pennsylvania, large employers with more than 500 employees are likely to offer their workers these benefits because they can afford to do so. As Blake mentioned, many small and medium-sized cannot without statewide programs. By passing paid leave policies, this legislature can actually make a big play that gives small and medium-sized businesses, those who employ the majority of workers, these family-friendly policies to allow them to compete with large companies that already give these benefits. Doing so would be a game changer in the pitched battle for talent and retention of good workers. We always say there's a workforce shortage. There's not. There is a good paying and good family-friendly work shortage. Large companies do this because they can afford it and they know that they will be able to keep their employees from moving on to another employer. The lack of guaranteed paid leave, affordable child care, and schedule flexibility causes many working parents, especially women, to leave the workforce altogether. Of course, their exit has a damaging effect on the economy. More people out of the workforce keeps less money out of the economy. We have seen that the creation of statewide paid leave programs around the country puts money back into the pockets of working families and keeps them in the workforce. Packaging Senator Haywood's bill with the paid family and medical leave legislation will demonstrate that lawmakers in Harrisburg are prioritizing working families, listening to the needs of working parents, and tackling the affordability and workforce crises. This is what Pennsylvania families need. States like Massachusetts have done both. Pennsylvania can do it too. Given the strong bipartisan support for these family-friendly workplace measures in the Pennsylvania House and Senate, we look forward to working with all members to make the case that leaders on both sides of the aisle and in both chambers must prioritize these measures and pass them this year. Families cannot wait. Without action, Pennsylvania parents will continue to have to choose between the immediate health of their children and the long-term financial stability of their household. Without action, parents will miss important life moments their kids may achieve at school, moments that make a lifelong impact on kids. With action, by passing family-friendly policies, the General Assembly has an opportunity to create a stronger, healthier, more sustainable workforce that will attract young families to Pennsylvania, imagine that concept, and then strengthen our economy in the long term overall. Thank you.
Well, thank you both for your insight and testimony. And addressing affordability is one of our top priorities. And that fiscal cliff that we talk about, it just, families are so close to that. And as we've looked at affordability, whether it's healthcare, energy, housing, the amount of family members and community members in Pennsylvania that are so close. Policies like these, I mean, will go a long way, and obviously you see the bipartisan support. We are the minority caucus, but we're an effective caucus. We will continue. We host policy hearings like this to highlight key issues and to put pressure on the majority to pass legislation and to run it. So I will open up to any questions from my colleagues. Senator Haywood.
Yeah, thanks so much. So on business size, you say you're 4.5. Some states have like a 10. Tell me what you think about the business size qualification that, tell me what you think about business size qualification.
Yeah.
Solo practice, solo, I mean, 2 people and 1 person's out. We'd be glad to hear what you think about that.
Children First has a report, had worked with many businesses across Pennsylvania for supporting of these paid leave policies. What we have found, now that we have 20 years of paid leave policies around the country, California passed their law back in 2000, or 21 years ago now. And since, as was mentioned before, 13 other states, when you include DC, have passed extensive statewide policies. We have evidence that shows this actually supports small and medium-sized businesses. So any rhetoric that comes from some business organizations that tend to say they are supporting small and medium-sized businesses is just not simply based on fact. When you talk to small businesses in other states that have these statewide programs, usually they are worried at first. Any kind of new mandate, as a small business owner, you have questions. Is this going to cost me a lot of money? Are people going to abuse that, as mentioned before? What we have found is it just doesn't happen. The evidence shows people need to work, they want to work, and when they have these benefits, they stay with their employer longer. And so it has actually saved small and medium-sized businesses up to 40% in recruitment and retention costs, because right now, people they're not going to stop having kids. Those kids are going to get sick when they go to childcare, when they go to school. They're going to need to go to the doctor. The kids are going to go to school. And guess what? The parents are going to need to take care of them. And so right now, as you're seeing, as was mentioned, mostly women, but parents overall are leaving the workforce because they don't have the protections they need to lose this income and at the same time take care of their kids. And so these statewide policies actually help keep small businesses competitive. Comcast, Merck, Johnson & Johnson, they give these programs. You talk to any of them, they will tell you it makes them more competitive. And so really what these programs do, they're very pro-small business. And after a year in all these states when they pass these programs, the majority of those small businesses support these programs because that initial worry about what it would do to them is unfounded, and they realize, oh, I keep that worker, I don't have to train a new one, and especially when you have trouble finding new workforce now, it saves them time and energy.
Just to add briefly, everything that, and 2 quick points. Just wanted to reiterate the leaving the workforce. That's the biggest piece. Often you hear from folks, well, I only have X number of employees. If they leave, I have nobody to fill their shoes. These are folks who are leaving anyway. So they could leave for a short period, or they could leave permanently. And that's when we get back to the previous testimony about training employees, the cost of recruitment, the cost of training. All of those factors end up costing businesses more. Would like to piggyback off of earlier testimony as well. My husband is privileged enough to work for an organization, company that has recently done away with tracking paid time off. So you don't get minimum vacation, sick, none of that. They do not track your time off. Yes, it is a private tech company. But what they have found in the year and a half since they implemented that program is that their employees take less time because they're not trying to use up their paid time. And you can ask my boss who's sitting here. The last 2 weeks of December, I was out using up my paid time off. The statistics, as Dan mentioned, showed that those concerns, while understandable, are not supported by the data.
A couple other questions. I wanted to comment. I am a proud older adult. Someone's trying to walk away from that. I think my friend Mr. Golden, I'm not. Impact on social systems was mentioned. And could you elaborate on any evidence, any history, that you have that says folks do fall into public assistance or emergency systems who don't have this care? Can you tell us more about that?
Absolutely, and a lot of it is linked to paid family leave, a longer version of it. But there is a lot of evidence specifically around caregiving and that one event. So be it that sick child, the sick parent, the aging parent, it takes them out of the workforce, and then resultingly we see them not having savings. So we are again talking about our working population. These are a lot of our ALICE folks, asset limited income constrained employed individuals. They're full-time working individuals who are unfortunately in lower paying jobs, who are not provided meaningful benefits. And so what happens is you have this one event and they lose their job and they don't have a savings to rely on. They don't have either secondary income, or in some of them they do. It is still not enough to cover basic cost of living. We just talked about affordability issues. And so what you see in many of these cases is that then they are now qualifying for services, SNAP, TANF, Medicaid, et cetera. So those safety nets, which are critical and necessary, could be less utilized if some of these basic protections were provided. And I'd be happy to provide additional research. There's some of what my written testimony does touch more on that. So there are some statistics and studies within there, but I will certainly happily provide more.
Yeah, I think that's extremely helpful. It'd be even good to have some assessment of what it means for taxpayers. Because as taxpayers, now we're paying for more folks to rely on these social systems who would not have to rely on the systems if they were just given time off so they could continue to work.
Luckily for us, I have that.
Oh,
So
thanks
a
so
benefit,
much.
so Prenatal to 3 Policy Center out of Vanderbilt University did a benefit cost analysis, and I'll make sure that it's submitted for the committee, that showed that the Family Care Act, obviously a much more extensive program, but when you have paid leave policies, it kind of follows suit. It would generate about $379 million more annual net benefits to the state of Pennsylvania, businesses, and then obviously families as well. So it generates about $379 million. It would also generate about $1.7 billion in lifetime net benefits for just births alone in Pennsylvania. When it talks about saving money, if we had HB 200 and SB 906, about $3.4 million in additional income tax revenue and about $14.9 million in sales tax revenue. It would save about $28.1 million in healthcare costs every single year, about $109 million in additional household income annually, and it shows point after point after point in terms of saving the state on SNAP benefits, saving the state on other social service benefits, and when you keep people in the workforce, we can only imagine the amount of money that they are able to then spend and put back into their local economy and our local small businesses that would directly benefit from this as well. And so there has been research done that shows the long-term benefits on a more extensive program, but obviously that would follow suit with a program like this.
Thank you so much.
Yeah. And by the way, it would cost the state $0 because it's an insurance fund that's paid for.
Go ahead.
One maybe quick point on this, and you both certainly hammered home the benefits of retention of the workforce and the savings that's involved there. And that's one thing, we definitely hear consistency from employers. It's that, having people with stability, staying there, they don't have to be retrained. And again, you guys really hammered that home. Is there any effort to, and it seems like employers would get this, but is there any effort to educate that segment of like new worker population? And it's probably, I don't want to be, ageist in it, but it's probably the younger members of the workforce that don't have the constraints of the sandwich generation yet, but will age into that in their workforce, but maybe not thinking about that in advance. In the same context as sometimes there's lower wage jobs, but they provide better benefits in healthcare or these other important ancillary benefits. I mean, is there any effort to educate that segment where it's where they may start to demand that from employers, or even advocate to us to make that a reality? Have you seen any of that?
Oh yeah, well, I mean, we have some of the best universities we're at one right now in the country in Pennsylvania, and those kids leave. When you look at polling and surveys around the country from national organizations and other states, they're leaving companies that don't offer, or not going to companies that don't offer these benefits, and they're going to states that do. And so even like Senator Miller, you're in an area in Northampton, Lehigh, like they're going to New York or New Jersey. Around here, they're going to New York, New Jersey, Maryland, or Delaware. They have a lot of options. It's not a far drive from there where they could still come back and see their parents and family members. So they're actually leading the way in forcing these issues and forcing corporate America to make these changes. Because corporate America recognizes when they, the big ones, they're going to always need workers. They're going to always need to offer these benefits. and they're able to do so, so they do. Yeah. So we're in a great state where we have all these universities, whether you're in Pittsburgh, whether you're in the Philly area, or in State College as well. They're not staying here. They're gone, and that's going to be a huge issue, as we already know. We keep talking about age in an aging state where we're not going to have the workforce and the talent to be ahead around the country. We're going to continue to fall behind when it comes to economic success.
And just
Follow up, the emphasis then is more in the bringing those smaller to
Oh, yeah.
the competitive, like, to be more competitive with the larger than, because
Yeah.
the mindset is already there.
Right.
Right.
Right. And it's, we often try to, in Pennsylvania, solve a problem after it's already happening. This is an opportunity for us to lead the way. Massachusetts has this program. We could do the same. Most of those states have been led by just one party. This is a state of Pennsylvania where we have to always make compromises. And we read off the support on each side of the aisle. We can work together to get all this done, and it would set a precedent around the country that this should be a national way that we focus on our workforce culture and our culture around parents and working in the economy as well. So we can actually be the leader on issues like this because we are coming to compromises to make sure that it's set up both for small businesses and families.
And I would thank you. I would add, we would, not only would we be the leader, we'd be the leader because Massachusetts is unpaid. So if this bill were to pass as is, we would be the first to pass a paid Short Necessities Leave Act. And additionally, in the written testimony that I shared, one of my recommendations was education, as you said, just as that mentioned, because folks don't know their rights. Most of the time, you might see the FMLA poster up by the, clock in, clock out machine, but for the most part, folks don't know their rights, and specifically folks that are in lower wage positions. So ensuring that folks not only know that this is an option for them, but an additional recommendation was what is the process if a complaint needs to be filed. So ensuring that there is a process so that folks can have their rights upheld and can access the leave they so desperately need.
Okay. Seeing no other questions, again, appreciate both your testimony. Thank you very much.
Thanks for having us.
This will conclude supporting families, moving into the backing workers and communities. We've got testifiers from SEIU 668 and Community Legal Services as well. We've got Nina Kofi and Hillary Shaw. You can join us up front here. Oh, we got on Zoom. Oh, yes, Hillary's on Zoom. Nina, you can kick us off. Oh, yeah. Yeah.
Chair and members of the committee, thank you for the opportunity to speak today. My name is Nina Coffey, and I am the Secretary Treasurer of SEIU Local 668, and I am also a mom of two, my oldest a child with disability as well. I have previously worked in a county assistance office, and today I'd like to just share my perspective of why I think this is great legislation and we need to advocate it from the perspective of someone from a county assistance office. I am here today in support of the Small Necessities Leave Act because it addresses a simple reality. People sometimes need a small amount of time to take care of their families, and they should not have to fear losing their jobs because of it. When I worked in a county assistance office, I spent my days assisting people who were already doing everything they could to get by. Many of the people coming through our doors were working. They weren't looking for handouts. They were trying to make low wages stretch far enough to cover rent, food, utilities, and childcare. I regularly met with parents who were working full-time or close to it, sometimes juggling more than one job and still falling short. They came to us seeking to supplement poverty-level wages with little support so they could stay afloat. And what stood out to me was how hard it was for them to access help. People tried to apply for benefits during 15-minute breaks, lunch breaks. They came in late, stressed, apologizing because they were afraid to miss work. Some had to leave early before their time with me was finished so that they could get back to their shift. Others missed appointments entirely because their supervisors would not approve them to leave or because they could not risk losing hours or being written up. I saw parents trying to complete paperwork while watching the clock, knowing they could not afford to be gone too long. I saw people make impossible choices between keeping their jobs and getting the help they needed because their current jobs were not paying enough to cover these necessities. A lot of the concerns we address in the office impact clients' medical eligibility, ability to provide for their families. They were everyday responsibilities of raising children and caring for family members. But the system treated them as inconveniences, and so did many workplaces. When workers could not take a moment to handle these things, the problems compounded. Missed appointments, those lead to delayed benefits. Delayed benefits, that meant more instability. More instability meant people falling further behind, even though they were working. This bill would have helped many of the people I worked with. It would have given them a little breathing room and a little dignity. From my role at SEIU Local 668, I hear similar stories all the time. Workers are not asking for a lot. They're not asking for weeks of leave. They're not asking to be paid when they're not working. They're not asking for special treatment. They are asking for a small amount of job-protected time to handle basic family responsibilities that arise in real life, and this is not a lot. Right now, many workers do not have that protection. Even when supervisors want to be flexible, the rules are not always clear or consistent. And that leaves people guessing and worrying about whether doing the right thing for their family will cost them their job. This bill provides clarity and peace of mind. This also impacts our workplaces. When people feel supported, they are more likely to stay at their jobs. When they feel punished for caring for their families, they burn out and/or leave. Losing experienced workers over a few hours of missed work doesn't make sense. When people know that they can take care of their family responsibilities without risking their jobs, they are more focused, they are more reliable, and they are more likely to stay long-term. As a parent, I know how important these moments are. A school meeting is not just a meeting. A doctor's appointment is not just another errand. These are moments that help kids succeed and families stay stable. Too many parents go into them stressed and distracted, not because of the family issue, but because they are worried about what will happen at work. No one should have to choose between being a good parent and keeping their job for a few hours. Work has changed, families have changed. More people are caring for children, parents, or both. Workplace rules have not always kept up. This bill does not try to solve every problem. It addresses one very common situation that working families face again and again. Sometimes small changes make a big difference. We support the Small Necessities Leave Act because it reflects how people actively live. It gives workers a little breathing room, it gives employers clear expectations, and helps families stay stable. I respectfully ask you to move this bill forward. Thank you for your time, and I will address any questions that you have in regards to the perspective from a county assistant's office.
Thank you very much. We'll hear testimony from Hillary Shaw, and then we'll open up for questions. Hillary, can you hear us?
I can hear you.
Okay, go ahead. Thank you.
All right. Thank you, Chair Miller, Sponsor Senator Haywood, and distinguished members of the Pennsylvania Senate Democratic Policy Committee. My name is Hillary Shaw, and I'm an attorney in the Employment Unit of Community Legal Services. Community Legal Services is a nonprofit legal services organization that provides civil legal assistance to over 130,000 low-income residents of Philadelphia each year in numerous substantive areas, including housing, dependency, consumer rights, foreclosure, employment, public benefits. In the employment unit, I represent low-income workers facing workplace issues such as discrimination, wage theft, Family and Medical Leave Act violations, and barriers to maintaining employment. My work focuses on supporting pregnant and parenting workers as they navigate conflicts between work obligations and family caregiving responsibilities. And one of the most common and most destabilizing issues that my clients routinely face is the lack of access to paid leave. That's why I'm here. Community Legal Services supports the Small Necessities Leave Act. And today I would like to share why we believe this bill will be beneficial for parents and children, particularly from the perspective of our clients, and explain the very real ways our clients are currently being harmed by the absence of paid leave. As we've heard today, the Small Necessities Leave Act would require covered employees to provide a modest amount of paid leave, only 24 hours per year, for essential caregiving activities, including participating in school activities, accompanying a child to routine medical or dental appointments, and assisting elderly relatives with routine care. In practice, these are precisely the moments when my clients are forced to choose between being present for their families and keeping their jobs. For low-income workers, that choice isn't theoretical. Many of our clients work in jobs with very rigid schedules and little or no paid time off. Pennsylvania currently has no statewide requirement for paid leave for those basic family needs. And as a result, parents routinely risk discipline, termination, or lost wages simply for taking a child to a doctor's appointment or attending an important school meeting. And if parents miss appointments for their children because of work commitments, it can even lead to child welfare system involvement, which I've also routinely seen in my position here at CLS. These avoidable harms hurt working parents, and they subject children to higher poverty rates, more instability, unnecessary trauma. The activities covered by this bill almost always occur during standard work hours. I can't count the amount of times I've been on the phone with a client who has to make this difficult decision. And workers with rigid schedules should not be forced to choose between keeping their jobs and meeting their children's basic educational and medical needs. Single parent households, dual income families are increasingly common, especially amongst our clients here at CLS. And many parents lack extended leave or other support systems to step in during the workday. Without paid leave, parents are left with no realistic options. And so this bill would prevent avoidable job loss by establishing clear, uniform standards rather than leaving leave decisions to ad hoc employer discretion, which is often applied inconsistently and unfairly. Unfortunately, federal law also doesn't fill this gap. The Family and Medical Leave Act provides only unpaid leave. It's limited in scope, and it excludes many low-wage workers altogether due to employer size and work history requirements. It additionally only provides leave for parents to take care of sick relatives if the illness is a serious health condition, and doesn't include those routine medical or dental appointments. Even when workers technically qualify for FMLA, unpaid leave is often not a realistic option. For families living paycheck to paycheck, taking unpaid leave can mean falling behind on rent, utilities, childcare, and the difference between unpaid and paid leave is often the difference between stability and crisis. In our experience, access to paid leave benefits employers as well as workers. I know that we've talked a bit about this in previous panelists, but I just want to reiterate, in my experience, employees who are able to attend to their family's basic needs are more likely to remain in their jobs. They perform better. It avoids unnecessary turnover. And this bill also supports workplace stability while imposing only a minimal burden on employers. It's also important to recognize the equity impact of this legislation. Low-income workers and workers of color are disproportionately represented in jobs without paid leave and with rigid scheduling requirements. As a result, they bear the greatest risk of job loss and financial instability when caregiving needs arise. The Small Necessities Leave Act functions as a targeted equity measure that promotes family stability, promotes economic security, and promotes fairness in the workplace. So just to conclude, CLS supports the Small Necessities Leave Act because it offers a practical, balanced solution to a widespread problem. It provides clarity to employers, dignity to workers, and stability to families. Parents and children in Pennsylvania should not have to continue to make the choice between supporting their families and maintaining needed income. And for the clients that we serve every single day, this act is going to make a meaningful and immediate difference. Thank you.
And thank you very much for your testimony. We'll open up to any questions. Sarah Haywood.
Thank you again for the testimony. Very compelling. So, Ms. Coffey, you mentioned folks are concerned about what will happen at work. Well, those are the words that you use. What will happen at work? What have you heard from individuals about that fear or concern that this legislation may help to address?
Each client who comes in has a different story, and it's heartbreaking, a lot of the different accounts that we've heard. But I've had clients who have come in and they're worried about things from what will happen when they have jobs where they're serving consumers and there is a lack of preparation on the employer's behalf to have backup staffing, to people who are at daycare facilities where they're already potentially just barely making those impacts because they're not appropriately staffing. And if this particular client doesn't show to work, what is going to happen, the stress that is occurring back at the workplace, and will that potentially impact their employment opportunities? That's a lot of stress when you're trying to just apply for SNAP benefits or renew a medical application.
How have you seen that stress manifested?
I've had people come in just tearful. We've had clients come in because they don't understand the process. They're stressed at work. They're angry. They don't know how to vent the frustration. And unfortunately, it comes out on our members. On myself, I've been a person who has had to de-escalate a situation. This could be prevented.
So you mentioned this is a matter of dignity, and so did the attorney from CLS. I was an attorney at CLS a long time ago. But both of you mentioned that this was a matter of dignity for employees. How do you see that? How did you get there?
So workers have been under attack for quite some time now, I feel. And when you're already struggling just to make ends meet, you're doing your best, you should not have to feel worried, ashamed if you're needing to come to an assistance office to be able to help your family thrive and succeed. You should not have to sit there and wonder, am I going to lose my job? And then have that type of stress added to an already stressful situation. Allow people to come in and get the help that they need and be able to leave feeling that they have been respected and they have dignity.
For both of the panelists, I would like to hear how you may see addressing small necessities as a way to avoid big challenges, catastrophic situations, because we have heard from some other panelists that sometimes if you don't deal with something that's small, it'll build up and create something much bigger later on. Do either of you two have any, can you share anything about this, dealing with the small to avoid something large?
I can go first. Being able to have the ability to come in and not worry about loss in wages or potentially losing your job, to respond to an inquiry that has been presented from the county assistance office, or to just be able to renew something successfully, one, reduces the error rate. That is something that Pennsylvania is dealing with, and it is a huge factor. We have to keep our error rate below a certain number. And we have clients where, unfortunately, they do have questions, or they may struggle to read, where they need that in-person interaction. But because they are denied leave, they're denied the ability to come out, there's delays in the benefits. Sometimes things have to be closed. There's errors. This would, one, help with the error rate. This would also be able to help, though, with people unnecessarily losing employment for something so minor. People who are working retail, restaurant, childcare, they're working 2-3 jobs. Being able to come in for an hour appointment is not asking for that much.
I'll just add on to that. Yeah. Go ahead, Haley.
Oh, sorry. I just wanted to say, I wanted to add on as well. I think something that I've consistently felt when interacting with the clients that I do is that poverty is expensive. And one of the main goals that I have whenever I talk to a client is I want to help them maintain their job, because not being able to keep your job or losing out on wages has really devastating downstream effects for low-income people who are working paycheck to paycheck. If you one day make the decision that you want to attend a school meeting, you want to go to the doctor's appointment, you want to prioritize your family, and you get terminated, that causes significant effects later on, and can really financially devastate a family for much longer than just, an hour that it took to go to that doctor's appointment. So just wanted to put that out there.
Not seeing any other questions. Senator Haywood, closing remarks. And I know our chancellor is in the room. Yes, you have a question? Sure, yes,
Come to the mic.
yeah.
Thank you so much.
Yeah.
Anyway, hi, I'm Anicia. While I was listening to this, I kind of realized that there was a lot of, because I know the big topic is like being able to leave or like leave for an hour or so, for things like doctor's appointments or things like that. But I feel like there's an underlining, because this is like kind of a comment and a question, but there's like an underlining thing of obviously the stability of families and being like paid enough. Because a lot of the people who came and talked up here, a lot of their like underlining like explanations were that the families were scared to be unstable, or they were scared to lose their job, or they were scared to lose money, which kind of brings up the thought in my head, like, because I'm not from Pennsylvania, I'm from Louisiana, and I know the cost of living is different in every area. And so coming from somewhere where the cost of living is relatively low, but you still get paid not enough to live, and knowing that if you come to Pennsylvania, you get paid more, but the cost of living is more. So I was just wondering if, by hearing these different types of scenarios and things that want to be pushed forward, does it just like channel something like in your mind to maybe think about how maybe not even just how the leave is a problem, but how the cost of living is a problem? Because you can have hours or days of leave and you can get paid for them, but if you're still getting paid whatever you're getting paid, that's keeping you on the edge of actually becoming successful. I feel like there's just a gap there.
Yeah, and point well taken. I mean, it's on both sides of things. It's raising the minimum wage, which our caucus champions, there's a number of champions within our caucus that have introduced legislation on doing just that. And then to your point on affordability, it's meaningful steps. I mean, housing has been in crisis mode for a while now, addressing housing, the supply on the housing side. Healthcare, we know the premiums have shot through the roof with the tax credits that expired. And then energy, your electric bills. These are all things that are very real to community members across Pennsylvania, not just here in Abington or in the Lehigh Valley. We've got a number of different proposals from our caucus that would address them. It's putting pressure on the majority caucus to actually run them and get them to the governor's desk to sign. So we're working on that. It's, things just like this, highlighting important conversations to make meaningful change for our community members. But thank you very much for pointing that out. But it's very real. It's both the income side and also the affordability. Senator Haywood, if you have any other thoughts too.
Yeah, I think what you'll find in problem solving is there will be 6 or 8 solutions, and if you look at one of them, it's inadequate. If you look at 2 of them, it's inadequate from being comprehensive. On the other hand, if you can't do all 10, then you need to do something, right? So that that we need to raise pay, we're all for that, right? Although this isn't we've had other conversations, that's not this hearing. So I don't want you to think, as Senator Miller said, that we are not advocating for raising pay. We are. But the leave is another part of the solution. Thanks so much.
Thank
and
you.
thanks for your courage.
Yes, thank you. Yeah.
In terms of closing.
Go ahead, Senator
Yeah,
Haywood.
thanks
Yes.
so much. So certainly I'd like to thank all those who testified, whether in person or online. Again, like to thank Penn State Abington. Thank you. This has been a tremendous host. It looks some folks have brought some lunch sandwiches. whoever arranged for that, certainly want to thank them as well. But especially those who spent some time listening to the solutions that we have shared. The testifiers were tremendous in helping us understand how we can make a difference, and we will need a lot of public support in order to make this happen. Thank you again.
And thank you, Senator Haywood. Chancellor, a couple of remarks too. Again, thank you for hosting us.
Thank you, Senators Miller and Senator Haywood for
Hit that button right there. Yeah.
Simple things. Thank you, Senator Miller and Senator Haywood, for entrusting Penn State Abington to host this important conversation. We heard a number of compelling remarks and comments from very passionate people today, and we're proud to be the host. Penn State Abington this year is celebrating its 75th anniversary, and in those 75 years, we've always strived to represent the people and support the people of Montgomery County and Philadelphia, much like the two of you do, to fulfill part of our mission as Penn State's land-grant university. Today, in our 75th year, we stand strong with nearly 3,000 students and more than 25 majors you can complete right here. And as part of that mission, we have what's called the Abington Experience, where we have a value added to our education, where students can engage in research, travel, internships, and most importantly, leadership development, so they could aspire to positions like the two of you have. So thank you again for entrusting us with this. We look forward to our continued partnerships with you both.
And thanks again. And just to kind of wrap up and close this out, this was recorded. This will be posted on our website. Any other comments for the committee or caucus members, please feel free to follow up. We'll hang out here for a little bit. As Senator Haywood pointed out, we do have boxed lunches for anyone that is hungry. I know it's lunchtime. And again, appreciate everybody for their testimony. This is obviously, just a small piece in the puzzle for addressing affordability and making Pennsylvania, communities across Pennsylvania, to places that people feel welcome and invested in. So again, thank you very much. Appreciate it, and we'll stick around for any further questions. Thank you.